Welcome to the Depth Dive. There's something really incredibly precious about new life, isn't there? For anyone who loves horses, the journey of a pregnant mare is just as miraculous, but it can also be incredibly challenging. Today, we're taking a deep dive into a really important topic, equine high-risk pregnancy. We've got a whole stack of your sources here, articles, research notes, and they really shed light on, the diagnosis, treatment, and management of these really delicate situations. So our mission, it's to pull out the most important bits of knowledge, kind of give you a shortcut to being well informed about this critical area of equine health. You're going to understand what makes a pregnancy high risk, how vets actually identify it, and, well, the interventions that can truly make a difference. It's all about giving these mares and their foals the very best possible chance.
Yeah, and what's fascinating right from the start in these sources is how clearly they define what a high-risk equine pregnancy actually is. Essentially, it's any pregnancy that's prone to early termination, delivery of a compromised foal, and or prolongation due to maternal, fetal, and/or placental abnormalities.
Okay, so it's much broader than just, losing the pregnancy. It's also about the health of the foal that is born and, critically, the mare's own well-being, too.
Exactly. And the sources point out that at the heart of many of these issues is often a disruption in the timing of labor. Either it starts too early or the pregnancy drags on too long. In both scenarios, they typically mean the foal is under stress.
Right. Here's where it gets really interesting, I think. What actually causes a pregnancy to become high risk? You mentioned it's complex.
It really is. It's often not one single thing, but like you said, a complex interplay,
Mhm.
almost like a domino effect. We can break down the root causes into maybe three main buckets: conditions affecting the mare herself, things affecting the placenta, which is the foal's lifeline, really, and then issues with the foal itself.
Okay, let's start with the mare then.
Sure. So sometimes it's about pre-existing problems she had before she even got pregnant.
Mm.
Think about conditions like PPID, that's pituitary pars intermediate dysfunction, common in older horses, or MSR, which is equine metabolic syndrome and insulin resistance. These metabolic issues affect her whole system, including
Yeah.
her ability to, maintain a healthy pregnancy. Even chronic laminitis or problems inside the uterus like chronic endometritis, this is persistent inflammation, or endometrial periglandular fibrosis, which is basically scarring. All these can impair how the placenta works.
Wow. Okay, so her general health beforehand is huge, but what about things that crop up during the pregnancy?
Yeah, good question. That's the second group of maternal conditions, the gestational ones. This could be anything from poor nutrition, a serious bout of colic, or endotoxemia, which is a nasty systemic inflammation. Hyperlipemia, too much fat in the blood. That's a specific worry for, say, overconditioned American miniature horses, ponies, and donkeys. Then you've got structural problems like prepubic tendon rupture, a tear in the abdominal wall supporting the uterus, or uterine torsion where the uterus twists. And of course, laminitis or other musculoskeletal diseases can unfortunately develop during pregnancy, putting immense stress on the mare.
It's kind of surprising, isn't it, how something like chronic laminitis, which we often think of as just a foot problem, can impact pregnancy so deeply. It really shows how linked everything is. What about like outside factors? Toxins, infections.
Oh, absolutely. External factors are significant. Exposure to certain toxins is a big one, like ergopeptine alkaloids, found in endophyte-infected fescue grass or even other contaminated grasses and grains. That's a classic example. And then, sadly, infections, things like equine herpes virus or various bacteria.
Mm.
They can be devastating.
Okay, so moving on to the second category, placental condition.
The lifeline. Exactly. The placenta is the life support system. It delivers oxygen, nutrients, removes waste, everything. So problems here include placentitis, that's inflammation or infection of the placenta itself, or placental insufficiency, where it's just not doing its job properly. Then there's early separation, which owners tragically might know as the red bag emergency. The placenta detaches too soon,
That's always an emergency.
always. Then you have things like umbilical cord torsion, where the cord twists, or hydropic conditions, that's too much fluid around the foal. MRLS, male reproductive loss syndrome, is another placental issue. And even with advanced techniques like cloning, specifically somatic cell nuclear transfer, the sources know placental abnormalities can occur.
Wow, the placenta sounds incredibly vital, but also vulnerable. And the last category, the foal itself, can cause problems.
Yes, absolutely. The most common fetal issue the sources bring up is twin pregnancies.
Right. You hear about that.
Yeah. It might sound good, 2 for 1, but horses just aren't built to carry twins successfully. It puts huge risks on both foals and the mare. Other issues could be specific fetal abnormalities, like hydrocephalus fluid on the brain or IUGR, intrauterine growth restriction, meaning the foal just isn't growing properly.
So it's smaller than expected.
Exactly. Or fetal trauma. All these things, in different ways, mess with that crucial gas exchange and nutrient transfer. They slow growth. A really clear example is that equine fescue toxicosis we mentioned. It affects the mare's hormones, which leads to a longer pregnancy, and this fetal dysmaturity, a foal born on time but underdeveloped. Ultimately, these challenges can hit nearly all organ systems, in both the mare and the developing foal.
Okay, so given this whole range of potential problems, how do you even start to know if a mare is high risk? For owners, it must feel overwhelming. What are those first clues?
You're right, it starts with really careful observation and knowing the mare's history inside out.
Yeah.
Has she had issues before during pregnancy, like serious colic, uterine torsion? Has she had any abnormal vulvar discharge? That could signal infection.
Okay.
Or, counterintuitively perhaps, has her udder developed way too early? Is she dripping milk weeks before she's due? Or, the flip side, a complete lack of udder development late in pregnancy. That's a big red flag for fescue toxicosis.
Interesting.
Yeah, and definitely a history of previous placentitis, fetal loss, difficult birth, or delivering a small, weak, or abnormal foal. Those are all huge indicators. Plus her existing conditions, PPID, MSR, laminitis, or if you know she's been exposed to fescue.
Yeah.
All pieces of the puzzle.
So the mare's body often sends signals if you know what to look for. And from the vet side, during a physical exam, what are they zeroing in on?
During the exam, the vet's looking for general signs of illness fever, not eating, lameness. That abnormal vulvar discharge is key. The premature udder development or milk dripping or the lack thereof, very important. The red bag, of course, premature placental separation, that's an immediate, undeniable emergency.
Right.
Excessive abdominal swelling could point to body wall problems. And even blood tests, looking at the mare's hormone levels, progesterone, estrogen can give clues about the foal's well-being and how the placenta is functioning.
And what about the foal itself while it's still inside? How do we know it's the one at risk?
Well, often the first sign of fetal stress is unfortunately recognized only when a compromised foal is delivered. But we do have tools to look inside beforehand. The key tool is ultrasound, both transrectal and transabdominal.
Okay.
With ultrasound, vets can watch the foal's activity. Is it moving normally? Too much? Too little? They measure its heart rate very carefully. What vets are looking for isn't just a number, but a stable heart rate in the expected range and how it responds to movement. Big deviations, irregular rhythms, those are major concerns. They also look for fetal breathing movements. Even the amniotic fluid, the fluid around the foal, tells a story. Too much hydromenose might suggest certain issues. Too little can indicate distress or lack of oxygen. Sudden changes in how the fluid looks on the ultrasound late in gestation. That might mean the foal passed meconium, its first stool, which is a sign of distress. We also track the foal's size, make sure it's growing right for its age, and crucially, we assess the placenta's health. Ultrasound lets us measure the CTUP, combined thickness of the uterus and placenta.
CTUP.
Yeah. If that measurement is thicker than normal, it strongly suggests placentitis. We're also scanning carefully for any signs the placenta is pulling away from the uterine wall. That's very serious.
Got it. So after considering all that, are some mares just more prone to this than others? Are there clear risk factors?
Yes, definitely. Certain breeds seem predisposed. This horse is mentioned. Thoroughbreds, standardbreds, draft breeds, American miniature horses, often linked to a higher chance of twins.
Ah, okay.
Age is a factor too. Mares over 15 are generally at higher risk. And as we've discussed, those pre-existing conditions like PPID, MSR, chronic endometritis, they significantly increase the risk. And remember hyperlipidemia, that excess fat in the blood, that's a particular concern for overconditioned minis, ponies, and donkeys, so their management is extra important.
Okay, now that we've covered the what's and the why and the signs, let's dig into the diagnosis itself. Once you suspect a high-risk pregnancy, how do vets confirm it? What's that diagnostic journey look like?
It's pretty comprehensive. It involves pulling together those observations we talked about with more specific tests. For the mare, definitely a full physical exam. Blood work is crucial, looking for inflammation, checking organ function. Specific tests can confirm underlying causes like glucose and insulin tests for MSAR. And hormone analysis is vital, measuring the mare's progesterone, estrogens, relaxin. These reflect fetal health and placental function. Prolactin levels, too, especially checking for that drop linked to fescue toxicosis. For the foal, as we said, ultrasound is king. Transrectal, transabdominal, It's essential for spotting twins, assessing fetal stress and viability, monitoring growth, checking the placenta. It's actually recommended routinely for mares who are barren, older, or have a history of problems. Confirming twins needs to happen early, ideally via ultrasound before day 90. Sooner the better, really. Oh, much sooner if possible, yes. While fetal ECGs were used, modern ultrasound machines often have that capability built in now, making ultrasound even more informative. Looking ahead, things like ultrasound-guided amniocentesis, taking a fluid sample, might become more common in horses, though it's riskier than in humans. It could potentially check fetal genetics or lung maturity. And finally, after delivery, examining the placenta itself or taking uterine biopsies from the mare gives what we call pathologic findings. It confirms underlying issues like chronic inflammation or uterine scarring, which really helps inform decisions about future breeding.
Right, so once you have that diagnosis, high-risk pregnancy confirmed, what's the game plan? How do vets manage these complex cases, trying to help both mare and foal?
Well, it really demands a proactive, often highly specialized approach. Monitoring these pregnancies, especially as foaling gets closer, is often best done in a dedicated clinic or hospital.
Somewhere with 247 care.
Exactly. Somewhere with constant expert attention. Early diagnosis is just absolutely key for successful treatment. You can't underestimate how maternal illness impacts the foal and placenta. The decisions vets face are tough. Do we try to maintain the pregnancy? Or is it safer to induce labor early? Maybe even perform a C-section. It's always a balance between the mare's health and the foal's chances of survival outside the uterus. If labor is induced, it needs intense supervision. And that newborn foal, it's almost certainly going to need intensive care, maybe immediate resuscitation airway, breathing, circulation support.
Wow.
Yeah, intensive nursing care might be needed for both mare and foal, sometimes for days or weeks.
Wow.
Activity usually needs to be limited, supervised. Although, interestingly, for mares with metabolic issues like MSR, controlled exercise can actually be part of the treatment.
Oh.
Yes, but for severe issues like body wall tears, tendon ruptures, bad laminitis, exercise has to be seriously restricted, maybe completely stopped. Diet is critical too. She needs a good late gestation diet energy, protein, vitamins, minerals. But again, it has to be tailored if she has something like MSR, where certain feeds could make things worse. And this really highlights client education. Owners need to understand that early diagnosis boosts survival chances, that managing underlying conditions is vital, and that interventions like induction or C-sections aren't without their own risks.
Makes sense. Beyond that general care and monitoring, what specific medications are in the vet's toolkit for these really tough cases?
Okay, so for immediate full resuscitation right at birth, you need oxygen, epinephrine, other emergency drugs ready to go. But to actually maintain the high-risk pregnancy, one of those common tools is a progestin, like altrenagist.
Right, you hear about Regumate.
Exactly, that's a common brand name. It helps keep the uterus quiet, reduces the risk of premature contractions, helps stabilize the pregnancy. How it's used, the dose, how long really depends on the situation, the risks, the vet's judgment, often given from early on right up until near term. Now, important precautions with progestins. Only use them if you're sure there's a live fetus. They can sometimes cause a mare to retain a dead fetus, and they're absorbed through the skin, so wear gloves.
So tip.
Definitely. Then antibiotics. Obviously needed if there's infection in the mare, placenta, or foal. The choice depends on the bug. But vets have to be careful. Some antibiotics could potentially harm the foal. Domperidone is another key one, especially for mares dealing with fescue toxicosis. It helps stimulate milk production and aids fetal maturation. But a potential downside is it might cause premature lactation, losing some of that vital colostrum. Anti-inflammatories like flunixin, meglum, banamine are used too. Maybe if there's risk of endotoxin release, or just for pain and inflammation. They might also help reduce premature uterine contractions. Main risks there are gastric ulcers and kidney issues with long-term use. Pentoxifylline is another anti-inflammatory used, particularly with endotoxemia. And there are alternatives, other progestins, different pain relievers, drugs for insulin resistance like metformin. The point is, it's not a one-size-fits-all approach. Each medication is chosen carefully for the specific problem.
It's clearly a very nuanced process, balancing everything. But you mentioned it's not over when the foal hits the ground. What happens next? And, crucially, how can owners try to prevent these issues in the future?
You're absolutely right. Monitoring continues. Mare and foal need watching until the pregnancy ends. And that foal needs a checkup within 24 hours, especially for FTPI, failure of transfer of passive immunity.
Making sure I got enough colostrum.
Exactly. Did it get those vital antibodies? And postpartum exams for the mare checking her uterus help figure out her chances for future breeding success. Prevention really starts with recognizing at-risk mares early, correcting physical problems, like poor conformation that might lead to placentitis before breeding, treating existing uterine infections before breeding. Consistent monitoring for mares with a history of problems is key, and complete, accurate breeding records are invaluable. Early twin diagnosis ideally like 14, 15 days, and then selectively reducing one embryo. That dramatically improves the odds.
That early, wow.
Yes, the earlier the better for reduction. And throughout the pregnancy, owners should be vigilant for any abnormal discharge or premature milk. And the sources really hammer this home. Get pregnant mares off fescue pastures or other contaminated feeds during the last trimester. 60 days before foaling is best, minimum 30 days. Other strategies. Maybe using embryo transfer for mares prone to early loss, avoiding breeding mares who have consistently had foals with congenital issues that might be inherited, being really careful with any medications during pregnancy, avoiding known toxins, even managing the environment, like controlling tent caterpillars to prevent MRLS. It's all part of prevention.
The stakes involved here are just incredibly high. What are the potential complications we're talking about for both the mare and the foal? And ultimately, what does the prognosis usually look like?
Yeah, the stakes are very high. For the mare, complications can range from abortion or difficult birth, dystocia, to retained fetal membranes, which can spiral into serious uterine infections like botrytis or endometritis. Laminitis is a risk. Systemic infections. All things that seriously affect her health and her future as a broodmare. For the foal, the risks are stark. Fetal stress, distress, death in utero, stillbirth, or death shortly after birth. And even foals that survive a high-risk pregnancy are more likely to be underdeveloped, premature, septic, struggle with getting enough antibodies, or have limb deformities compared to foals from normal pregnancies. Now, prognosis. Well, our ability to manage these has improved hugely, but success hinges on intensive, continuous monitoring. The prognosis is generally called guarded if the underlying issues are treatable and fetal stress is caught and managed early. However, if that stress progresses to actual distress, despite treatment, then fetal viability and the mare's own health become major concerns. The prognosis for a healthy term foal in those circumstances drops to guarded to poor. It really is a critical situation where time and expertise are everything.
So, what does this all boil down to for you, whether you're deeply involved in breeding, own a beloved mare, or you're just fascinated by horses? It really means that understanding these complexities, recognizing signs early, appreciating the vet's role, the management needed it, can genuinely make the difference between heartbreak and a healthy mare and foal.
Absolutely. If you connect this to the bigger picture, it's a testament to the constant learning in veterinary medicine, the dedication involved, and how crucial careful owner observation and partnership is. It all comes together to try and improve outcomes for these amazing animals.
Which leads to a final thought. Given this complexity and the really serious consequences of equine high-risk pregnancies, how might even more advanced non-invasive diagnostic tech, maybe even wearable sensors for mares, tracking subtle changes, how might that revolutionize early detection and management? Could it help push the prognosis from just guarded towards truly good for more of these vulnerable pairs in the future?